Now, we went through the fact that these tracts, either descending or ascending, are basically conduiting the messages. So the nerve fibers, there are different types of nerve fibers and spinal fibers out there that are basically functioning and helping the spinal cord to perform its function in a particular way. So we went through the fact that we have these ascending sensory pathways, and on the other hand, we have the descending motor pathways over here. Now, when we look at the ascending sensory pathways, we must know that we have different orders of neurons out there, ranging from the first order neuron, and this is the first order neuron, the sensory input, which is basically taking the sensations from the effector organs and then carrying these sensations towards the higher centers of the brain. And then finally, we have the peripheral spinal nerves that are basically contributing towards the sensory input of the ascending sensory pathways as well out here. Now, after these sensations are being carried through these ascending sensory pathways and towards the higher centers of the brain, there are relay stations, there are emotional stations, and then finally there is the sending back of the messages through these descending motor pathways. And this is the upper motor neuron, which is basically carrying the sensations from the higher centers of the brain and then towards the this is basically the gray horn of which is basically located in the spinal cord. This is the first order neuron. And then the second order neuron, it basically arises within the spinal cord, and then it moves on and it moves towards the effector organs, and these are known as the lower motor neurons. And even depending upon which neuron is damaged, there are the classical signs and symptoms that are being produced. Particularly in case of the upper motor neuron lesion, we have the Babinski signs, and we'll be learning about all of the upper motor neuron particulars specifically. And then we have a entirely different clinical picture which is seen in patients who are suffering from the lower motor neuron lesions. So this is how there is a general organization of these nerve fibers. Depending upon how fast and how slow this conduction takes place in the spinal cord, we usually divide these into three types, that is A-type fibers, alpha, beta, gamma, and delta fibers. We have the B-type fibers, and then finally we have the C-type fibers. Now, the A and the B-type fibers are basically very fast fibers, and then we have the C-type fibers, which are rather slow fibers, and they are even responsible for carrying the pain sensations towards the higher centers of the central nervous system. So these are the different types of fibers, and obviously these types are being concluded depending upon the speed of the sensations that they take up and take back towards the effector organs. And depending upon this quality, they're being classified into these three categories out there. And they're obviously taking up different sensations at different speeds.